Right, good to see we're getting a few more people joining in. Feel free to add your answers and comments through the chat. We'll provide live feedback as we go along. Okay, let's get 2 minutes on the clock and your time starts now. All right, time is up and good to see some answers coming through, everyone. Now, of course, this is pointing us towards decurvain tenosynovitis. We've got those classic findings of the pain and swelling on the radial side of the wrist and at the base of the thumb there, with the pain particularly on the gripping and lifting objects when using that thumb and the wrist there. Again, the pain's usually that kind of constant ache with that burning and pulling sensation, particularly on movements of the thumb there. Pardon me. As we've got some answers up already, of course, we do have the positive Finkelstein test, which is the deviation of the wrist towards the ulnar side with the thumb flex. So if you take your thumb, let's see if we can, that's a bit better. Take our thumb, you pop it into your hand and you wrap your fingers around it and you're pushing that fist down and you can feel that bit of a pull through the thumb there. It recreates a rather sharp kind of pain. I don't know if I've just got to hint myself, but it is a little bit uncomfortable to do. So positive practice on yourself, you'll see that kind of little tugging sensation. For people that do have decurvain tenosynovitis, it is an incredibly sharp, incredibly painful sensation there. So know what to look out for. Of course, that is going to be a fantastic gold standard kind of answer there, so that's going to give you the 3 marks. Likewise, tenderness over the base of the thumb, definitely going to give you 2 marks there. And tenderness of the first dorsal compartment extensor tendons on the thumb of the wrist is also going to give you lots of extra marks there. That's a pretty specific thing, and so this is one of those things I think that also awards extra marks for those that know what they're talking about here. Swelling in the anatomical snuff box is also a positive finding, and of course that decreased carpal metacarpal abduction range of motion of the thumb there. Sometimes in more serious cases you will get a palpable thickening of the extensor sheath, particularly along that first dorsal compartment, the back of the thumb, and crepitus of the tendons as they're moving over that compartment, as they're rubbing up against that sheath there. So lots of examination findings. You're going to get best bang for buck though with the Finkelstein test. Is one of those names you're just going to have to remember. That tenderness over the base of the thumb and the dorsal extensor compartment. All right, of course, more questions. So let's get 2 minutes on the clock and your time starts now. right, time is up. Let's have a run through some of the answers here. And so, what initial non-farm would we do for Dequa veins? This is something that I think most of us will have seen not infrequently. And certainly if you have seen someone, hopefully you've put them in an appropriate thumb splinting, spiker splint and forearm brace. Really important to immobilise right along that sheath there. That's going to get you the 2 marks. Patient education to avoid any repetitive or aggravating movements. I would be avoiding using the or there. I would stick to just one answer or the other, but both would certainly get you a mark and both would be lumped into 1 mark there. Likewise, pardon me, thermotherapy with ice packs or heat packs to patient preference and tolerance. Different people will try different things and find different results. So try each, see what works. Referral to a physiotherapist for dedicated hand or wrist exercises, again just specifying one, not both, and referral to an occupational therapist for modification of activities. This is a profoundly debilitating condition that if you are hit by it, you will often need to be modifying the things you're doing, the way you're doing things to maintain functional capacity. So again, some answers coming through. The thumb spiker splint, fantastic. Referral to hand therapist for range of movement exercises. I'm going to be super picky tonight because I have to be. Avoid the abbreviations there for ROM, so I'd spell it out, range of movement, but otherwise absolutely perfect there. And I really love as well that you've specified why you're referring that patient, so keep that up. Ice packs to area of tenderness, beautiful, and activity modifications. And I would say here, just on the kind of conciseness of it, I like that you specified stop lifting things, elevate left hand in bed. Just say 1. So again, I would simplify that down just to activity modification to reduce aggravating movements. If you are specifying multiple things in there, you do run the risk of overcoding, which again may actually give you a deduction in your overall marks. So just be careful, be cautious, get the marks you've earned. All right, we of course have yet another question here for you tonight. Let's get 2 minutes on the clock and your time starts now. All right, 2 minutes is up and let's go through to some answers here. So there's a few different risk factors here for Dequa vein tenosynovitis. First one being, and this will depend on which kind of resource you look at, age between 50 to 60 years or age over 50 years. Some sources even say age over 30 years. I think if you're giving some kind of reasonable answer with acknowledging that age is a contributing factor, you're going to get a mark. Likewise, female sex. We'll touch back on that one in a second as well. History of thyroid disease. So hypothyroidism is known to be associated with de Quervain's, as is being obese or overweight. So get a mark there. Now, one other big risk factor would be history of repetitive movements. And I want to really specify that this actually wouldn't get you a mark in this case because there's no actual history in the stem there. So make sure you read the questions and don't fall for some of those traps there. Yes, it is a common risk factor for it, but if they haven't put that in the stem, and this is asking for if there's anything she has done to cause it, what risk factors does Linda have for the most likely diagnosis? If they haven't put it in the stem, don't make information up. You will not get the marks. So we've got some excellent answers there. So you've got female, overweight, hypothyroid, U-Butte. Now, I do want to take a second as well to talk again about the female sex component to it. And this is a broader thing for a lot of other questions as well. The exam's often not trying to trick you up. They're often trying to give you as many points as possible. And it's usually a pretty safe bet that questions like this that are asking for what risk factors does this patient have, gender is often going to be a component to it. And they're usually, I'll say almost always, asterisk in the corner, almost always going to be giving you the gender that is the higher risk. They're not trying to trick you up. They want to give you the straightforward cases. And so you can usually say for something like this, if you're really stuck, can't think of anything else, you can use the gender as a potentially risk factor. Worst case scenario, you'll miss out on the mark. Best case scenario, you get a mark that you would have otherwise missed. Hopefully that makes sense.